Hello, my diet tribe. Welcome to another episode of Let's Talk Diabetes with Inkyurka, where I always share life-changing tips through a lived experience lens. So, as promised, I said I was going to talk about how we can prevent common mistakes in persons that manage their diabetes with insulin. And it's common knowledge that for you to effectively manage your diabetes with insulin, you actually need a very proactive approach. So I'm going to give you the key strategies I used, and this could be beneficial for people who treat their diabetes with insulin. So the first one is, I actually adopted 7 strategies. So I'm going to start with the first one. So the first one is improving my insulin management. So under improving my insulin management, I followed a consistent insulin routine. So I wake up in the morning, I take my long-acting insulin, my mealtime insulin, I take it 15 minutes before my meal. And at night, before I go to bed, I take my long-acting. So you need to maintain consistent insulin routine. And then I got to understand better my insulin to carb ratio. So this helped me to be very accurate with my dosing. And I also kept a log of my insulin doses, my meals and activities. So this actually helped me to identify patterns and I make needed adjustments. So when I'm having too many highs and lows, um, I actually had to speak to my diabetologist and he tweaked my insulin regimen. So these are all the things I did under like managing my insulin, understanding my insulin management. So the number 2 strategy I adopted is monitoring my blood sugar levels very, very frequently. So I always check my blood sugar level using my CGM. So this has made life a lot easier for me. And sometimes I do not ignore my highs or low blood sugar level warnings. And when I'm ill, stressed, or traveling, I actually check my blood sugars more often because all these conditions I have actually mentioned can affect your blood sugar levels. And then the third, very important, is improving diet and carb counting. So for persons using multiple insulin injections, you must master the act of carbohydrate counting. So what I used, the tools I used to help me are food scales, measuring cups, and the mathematics as well. So there's quite a lot of calculations involved in carb counting, and I always log my meals and insulin doses on my Libra app. So if you don't use a CGM, you can get like a handy notebook and always keep, because this will keep you right. You know the meals that cause your blood sugars to go sky high very quickly, and then you know how to adjust your portions and you know how to adjust your insulin to match the carbohydrates you're using, and you know how to balance your meals with enough fiber to reduce that spike up. And I always choose fiber rich whole foods. They help me stabilize my blood sugars, and I plan all my meals ahead of time. Number 4 strategy is I am always prepared for emergencies. So I always carry my glucose tablets, my sweets, snacks, fizzy drinks for quick hypo treatments, and I always have backup insulin, and I always wear a medical ID. And everybody knows me, I always educate my friends, colleagues, and family on how they should treat a low or high blood sugar levels. And then the 5th strategy is exercising smartly. Initially, I used to have troubles with this because I would have high blood sugars and still go ahead to exercise. And afterwards, I am saddled with having to deal with extremely high blood sugar levels and ketone in my blood. So I need to exercise smartly. So before I exercise, I always make it a point of habit to always check my blood sugars before and after, and I adjust my insulin or snacks as needed. And I always carry a snack during exercise to prevent unexpected hypos. They can happen. And if my sugars are above 13 or 250 mg per dl, I avoid any form of intense exercise, as this can worsen ketones. And my sixth strategy is managing mental and emotional health. I try to set very realistic goals to avoid diabetes burnout. This is something that is very, very, very important. Over the years, the goals I used to set were very, very, very unrealistic, and this resulted in a lot of burnout, in a lot of stress, anxiety. So now I try to set very realistic goals, and this has helped my mental and emotional health. And I always practice stress management by doing things I love to do. And my family and my support group give me so much support, and we all look forward to our time together where we share our lived experience. So this helps with the motivation side of things in our diabetes management. And then the seventh strategy, which is the last strategy, is that I keep up with all my medical checkups, where my pre-existing complications are always monitored, and there's a lot of treatment adjustments, as your insulin needs will always change with your age, activity, and other life events. So as promised, I have delivered. Remember, like, share, subscribe, and comment. And please keep sharing to a friend, So remember, stay tuned for the next upcoming video on Let's Talk Diabetes with Nkiruka on my YouTube channel. Bye.